people, both past and present, I welcome you to Politics of the Country and to Dairy Country.
Thank you, Gracious. We've got Ged here. She will be our first speaker. Ged is the President of the ACTU since 1st of July 2010.
Yay! Thank you for that welcome, and I too would like to acknowledge the traditional owners of the land on which we meet today and pay my respects to elders past and present. And thank you for having me. Now I know that I've been asked to come and talk to you about aged care and the Because We Care campaign in particular, which I was very, very proud of to be part of. Very proud to be part of when I was the Federal Secretary at the ANF, and I will talk a bit about that, but since I've been at the ACTU I've been involved in that really in a different way, and I'll really depend on Stella to fill you in from the New South Wales Nurses Association about where that's up to. But I'd like to take the opportunity, if I can today, to also talk to you about what I'm doing at the ACTU and what our plans are for this year and ways that I hope you can get involved, I think. That was a very long bio, I'm sorry about that. I'll have to get it to cut it. But I thought I would tell you, and some of you might have heard me tell this story before, but I have been involved with trade unions. Actually, I've been a member of a trade union since I was 5 years old. And how that came about, that's true, is my father was a publican in Richmond, and he had 9 children, and with a name like Kearney, you can imagine, big Catholic family, and publican, very archetypal. And we all worked like navvies in that pub, I can tell you, all 9 of us. And when I was 5 years old, my job was to do the dishes in the kitchen, and my mum, you pulled the 3rd drawer out, and she had put boards in it so you didn't fall through when you stood in it, and you did the dishes. And we worked pretty much as slaves, I'd say, slave labour. And when my brother was about 17 years old, he got jack of it and he called a family meeting. And he said to my brothers and sisters and I, we're going to form a union. We're going to be the Kearney Family Union. And I was about 5 years old, and I remember we drew up a list of rules, a little constitution, and we all had to pay our dues. And my brother then was elected secretary, and he went off and negotiated a whole set of terms and conditions for the family with my father. And there were things like wages, of course, minimum wages, they were on a scale. Things like study leave, you didn't have to work if you had exams the next day, stuff like that. My dad thought this was fantastic, he loved it. My mum thought it was a load of nonsense, she didn't like it so much. We took industrial action twice, I can remember. Once was when Mum was getting the cat spayed, and we thought that wasn't fair, we liked the kittens. Now, I know that doesn't sound like a very industrial issue, but we saw it as a kind of advocacy thing, animal rights and all that. And so we went on strike, refused to work. We sat on the floor in the kitchen, all 9 of us. I remember, my cousins too. My cousins were allowed to join the union, they were family. And my mother refused to feed us. And then she took to us with a broom. So we lasted till about 6 p.m, and the strike was over and the cat was spayed and we all went back to work. But nevertheless, we felt we'd exercised our rights as a union. And that union lasted a long, long time, and until, actually I was a member of that union until I joined the Nurses Union in 1985. And then I got very heavily involved. I don't know if you remember, in Victoria there was a very long nurses strike, a 50-day strike in 1986, and that's when I became very involved with the union, and when I felt the power of a union and the power of a collective. Even though my father was an employer, he always taught us that unions were an incredibly important part of a civil society, that they were about balance and about social justice. And you couldn't have that balance, and you would never have justice if you didn't have trade unions. And so when I started working, there's no way known I would have gone home without a ticket. I would have been in big trouble. So I was very proud to show my family my union ticket. And I have been a member of the ANF ever since. That was in 1985. And there were a number of experiences that led me to become the Victorian Branch Council, and then the President and Federal President, and then eventually I was elected Federal Secretary. And I really still don't quite know how I was an elected president of the ACTU, but it was a lot of hard work. I never would have dreamed back then in '85 that this is where I would be. But in the Federation, when I was secretary, the Federation, the Nurses Union, is, well, it's just that. It's a federation of very fiercely, and Stella will attest to this, independent state branches. And it's quite the case with such unions that they often look at the federal office with a little bit of suspicion and, and don't always want to work together as a group. But I have to say that aged care is something that really galvanised all of those branches into one very strong federation. We could see what was happening in aged care. It's the epitome, really, I think, of what's happening to a lot of public services in this country. It was privatised, it was deregulated, it was set up so that people could make profit out of aged care. We immediately saw, a trend of things that has happened in many industries. We saw become deunionised because there became lots of small, very small employers, almost like a cottage industry, really. And it's very, very difficult to organise when, there's some 3,000, 4,000 workplaces, small workplaces of that sort. So we saw unionisation fall away in the sector. We saw, I think, quality as well fall away because with some of the regulation, or coming away, I guess, from a large public sector and into a small for-profit sector, people will cut corners. They're trying to make money, of course, and unfortunately, and I think Stella would agree, we have seen a lot of quality issues in aged care. We saw a big shift, however, when people started to realise that perhaps it wasn't so profitable, that it moved to the charitables and the not-for-profit sector, who are now pretty much the major runners of aged care in this country. We saw the rise of unregistered workers in the sector. We have registered nurses and enrolled nurses, very hard-working people, a wonderful workforce, but very little standard around how they were employed, what they were paid, and the quality of the care that they could give. So, at the root of all of that, the Australian Nursing Federation worried for the sector, we worried for the people that were in the sector, and we decided we would do something about it as a federation. And I'm very proud to say that every single branch pulled together and formed the Because We Care campaign. The Because We Care campaign was quite a landmark for us. As I said, in many ways, it was really the first big thing that we did together. It was a concerted effort by us to organise a largely unorganised sector of the workforce, but also to improve the quality of care, and that was paramount to us. We really looked at the issue of wages, number one. Wages had fallen away. If you were a registered nurse in the aged care sector, you got paid between $300 and $400 a week less than a registered nurse in the public sector, who we thought was doing exactly the same job, equally important, if not more important. So there was a huge wages gap and a wages issue. We looked at transparency of accounting. This is a largely federally funded sector. So federal funding goes into the sector. There's very little accountability for how that money is spent by the aged care providers. Very little accountability. And we were worried about that. So we wanted transparency around the public dollars that went into aged care to make sure it was actually spent on nursing care, on quality care. We wanted some regulation around the unregistered worker to make sure that there was a minimum standards of education required, basic occupational health and safety, and that residents weren't put at risk by somebody having to care for them by people really who weren't qualified or trained to care for very complex needs of some elderly people. As you know, by the time you go into aged care, generally you have quite a few health problems as well. And what was the fourth one? It's just slipped out of my head. And skill mix, thanks Stella. And the skill mix. So whilst we certainly value every single role and every single worker in aged care, we think that there needed to be that proper mix of qualified people with the unregistered staff, and so that we could absolutely make sure that the care given to those people was adequate. So I've leapt ahead, I haven't even been looking at my notes, so I hope I haven't forgotten anything. So what did we do? We thought, well, how are we going to do this? And we spent a long time researching messages, we spent a long time thinking about it. And if there's one thing nurses do well, I reckon, is campaign around issues that the community value. So it's about values. And I think if you can appeal to community values when you're campaigning, you can actually get community support. And we knew that we would need community support to win this campaign. So we came up, we talked a lot to the community people, we talked a lot to our partners in the sector, to the stakeholders, and we've got a campaign together called Because We Care. And we launched that, we had lots of activities, we really, I think, went a long way to raising the profile of the issue. The media became interested, there were lots of interest groups began to work with us and help us highlight the issues, and I think we made a lot of inroads, and I'm really going to leave it up to Stella, is that right, Stella, to give you an overview, I think, of really where we got to. I talked a little bit before about values campaigning. I think the power of the Because We Care campaign laid in the fact that we all did it together. We all garnered community support. It was something the community really cared about. And it made me think about what the union movement does well. And I think when the union movement comes together as one movement, we campaign brilliantly. And it's because that really only happens when there's something incredibly significant. You think about the Heart is Asbestos campaign, how brilliantly that was run by an all-of-movement campaign. The MUA dispute, will we ever forget the MUA dispute? It was fantastic, and once again, that was because it was an all-of-movement campaign. Everybody came together, and I think there's nothing yet that could compare to the Your Rights at Work campaign, which in the end removed a government and actually a Prime Minister from his seat. Fantastic campaign. I mean, when the union movement gets it together, it really shines. So as President, I've been racking my brain, what's the next big thing for us as the union movement? What are we really going to take on? When I got into this job was in July 1, and that's where I met you guys, because I immediately was thrown onto the election trail, and I spent a lot of time up here and in Sydney and in various other states. And everywhere I went, I talked to people about what worried them. And it really hit me that the thing that worried people was the way that people were being employed, and I call it precarious employment. It's not a really catchy phrase, I know, but it's really about insecure work. What's happening in Australia at the moment is that around, I think it's actually less than 50% of people are employed in what we would call standard employment. That is permanent, secure work. Now people are employed by labour hire firms, casual employment, short-term contracts. We've got this whole issue of sham contracting where people are forced into being independent contractors even though they really are employees by any other name. You know, they have no control over their customers, they work for the one boss all the time, they do the same job, the same shift, and yet they're independent contractors where they have to pay for their own workers' comp, they get no paid leave, no sick leave, no carers leave. Saying we have teachers in this state, I know about 80% of your TAFE teachers are on short-term contracts. I have a friend in this situation, her contract in TAFE goes from March, the end of March, to the end of October. And then she's got nothing else, so she gets no paid leave, she doesn't clock up enough hours to roll over long service leave, she doesn't even qualify at the moment for the government's paid parental leave scheme because of the break between her contracts. More and more this is becoming the norm. We have people on 6-month contracts who have to worry every 6 months to renegotiate their contract. This is women in call centres are telling me this. Every 6 months they worry, am I going to have a job for another 6 months? They have to go through the whole painful process of renegotiating their job. There was a classic example that really highlighted it for me here in Sydney. You might have read about it in the paper, it was reported very widely here. There was a factory that made IBM computer parts. I think it was IBM, or put them together and assembled the computer. That entire workforce was employed on a casual basis by a labour hire firm. They got a text message the night before telling them if they had a shift the next day. They came to work the next day and the manager would handpick who got 4 hours, who got 6 hours, or who got 8 hours shift that day. Reminds you of the old wharfie days, the stories you hear about the wharfies. 3 minutes, bloody hell. So, no, I'll hurry up. She's a very good chair. Anyway, so I'm really only telling you those stories, and I'll just tell you one more story that just struck it home to me is some in Melbourne with ASU, our Victorian branch rang me. They said they just had 50 women sacked or laid off from a call centre. And then a month later, where they ring up and answer things, was a finance firm. They got offered their jobs back as independent contractors. Where, again, no leave, no sick leave. You know what, I don't have to tell you that. They were allowed to rent the phones and the computers from the company where just a month before they had been using them as employees. So now this is really what's happening in Australia, and I think we're going to take this on as a movement. This is something that we are really going to tackle. Sure, there's a place for casual labour, don't get me wrong, there certainly is, and there's a place for contracts, and there are many independent contractors who are truly independent contractors who have control of their life and their work. But there are many people out there, I think, who are living a house of cards, and this is something the union movement is going to take on this year, big time. And I hope that once we get the campaign rolling, once we get information out there, that good people like yourselves will help us fight this. So, thank you very much.
Thank you.
Thank you for having me, and really I'm here because of my role with the Quality Aged Care Action Group, and there's quite a number of members in the room here today. Annette and Shirley, who are speaking after me, run the Quality Aged Care Action Group up in the Blue Mountains, and they really are the linchpins of creating a community swell in the Blue Mountains focused on aged care. So I want to tell you a bit about the action group overall, and there's some other members here. I can see a nice row. Here we've got our president of the overall Quality Aged Care Action Group. Here is Lucille, and Judy and Shirley and June and Sally up the back up here. So it's lovely to see some familiar faces and a few staff also from the Nurses Union. Now, the Quality Aged Care Action Group really grew before my time at the union. It started up by conversations between some staff within the union and members, and then also people in the community who were associated with the work of the union and aged care, but who weren't necessarily nurses themselves. So it provided a fantastic opportunity for people who care about aged care to join in with a network of other people who actually have the tools and the resources, I guess, to bring to some community-based work. So that when the QACAG group started, it was made up of people who, many of whom were retired nurses, so they'd left nursing and they maybe had been working in aged care or other areas. They felt really strongly about aged care. There was people who'd cared for loved ones. Most often it was people whose loved ones had died because they then had the energy to bring to this work. It's very hard to be active and advocating for aged care politically when you're dealing with the enormity of someone who's living with dementia or other ageing conditions that requires care. It's quite hard to get involved in that political action at that time. So a lot of people bring their energy and their experience after they've finished their caring role. We have some members who are still in caring roles, and we do have some members who are recipients of care, and we have some people who live in nursing homes themselves. So the experience in the action group is really diverse, and the ages range from people probably in their low 40s right up until people possibly in their 90s. Some people get a bit cagey about their age, which is fantastic because it keeps us all on our toes. We don't actually focus on the age, but we actually respect the level of age in the group. There certainly are people who've got some 50 or 60 years worth of activism and experience to bring to the group. We've also got the support of some other groups such as the Retired Teachers Association and the Older Women's Network, and we have some strong partners such as the Combined Pensioners and Superannuants Association.